Did you know that every 6 minutes a senior suffers a stroke that could have been prevented? It's a blood-chilling statistic, but behind that number, there's a grandmother who will never tell stories again, a father who won't be able to walk in his garden anymore, a life that fades away in an instant. And the most terrible thing, what made me turn on this camera with an urgency I've rarely felt, is that new research reveals that many of these tragedies are linked to 4 common medications. Before we continue, tell me in the comments, are you over 60 or do you care for someone that age? What medications do you take regularly? Your experience can help other members of our community. Share without fear, we're here to help each other. Medications that you very likely have right now in your medicine cabinet, prescribed with the best intentions, but whose hidden danger is coming to light in an alarming way. If you're over 60 or care for your parents, I ask you to stay with me. I'm not exaggerating when I say that what I'm about to share can save a life, because one of these drugs that millions of people see as harmless as a glass of water could be dramatically increasing, sometimes even tripling, the silent risk of suffering a cerebrovascular accident, also called stroke, CVA, or brain attack. I'm Dr. Sophia Kira, and in my more than 20 years as a specialist in health and longevity, I've seen how the right information at the right moment makes the difference between an active old age and a tragic dependence. Today, we're not going to talk about theories. We're going to talk about science, published studies, and knowledge that, unfortunately, many professionals still don't apply. I'm going to reveal what these 4 horsemen of the pharmaceutical apocalypse are for the senior brain, and, more importantly, what safe alternatives you can and should discuss with your doctor. The last one on the list is the most surprising, and honestly, the one that angers me most. But first, let me explain what a stroke is. Imagine your brain is a bustling city. Your neurons are the houses, and your arteries are the highways that carry oxygen and nutrients, the fuel for everything to function. A stroke occurs when traffic on one of those highways stops completely. It can happen for 2 reasons. The most common is an ischemic stroke, a monumental traffic jam caused by a clot that blocks an artery. Without fuel, the houses, the neurons in that area, begin to die within minutes. The second is a hemorrhagic stroke. One of those highways breaks and blood floods the brain tissue, damaging everything. Both scenarios are catastrophic. The problem is that as we age, our brain becomes more vulnerable. It's like a classic computer. Incredibly powerful, full of wisdom, but its hardware is more sensitive. It doesn't process certain chemicals the same as before. And some of the medications we'll talk about today are like a virus that overloads the system, that short-circuits the cables of that invaluable computer. And the worst part is, they do it silently until it's too late. First culprit, non-steroidal anti-inflammatory drugs. The first group of medications is perhaps the most popular in any home. They are non-steroidal anti-inflammatories, NSAIDs, ibuprofen, naproxen, diclofenac. Sound familiar, right? The quick solution for headaches, back pain, for that morning arthritis. We buy them without prescription, take them almost like candy, convinced they're safe. And there lies the danger, in their false appearance of innocence. For a young person with a strong heart, an occasional ibuprofen isn't a big problem. But for someone over 60, especially if taking them daily for osteoarthritis or arthritis, the story changes completely. They stop being allies and become saboteurs. But how can something so common be so dangerous? It's not just one thing, it's the perfect storm of 3 mechanisms acting simultaneously. The first is increased blood pressure. Think of your arteries like a hose. Blood pressure is the force with which blood circulates. NSAIDs make your body retain sodium and water, increasing blood volume. At the same time, they can make arteries stiffer. The result? More liquid forced through a narrower, harder hose. Pressure skyrockets, and hypertension is the #1 risk factor for stroke. It's like forcing your house's plumbing day after day. Sooner or later, one bursts. The second mechanism is more subtle, affecting your kidneys and platelets. Kidneys are the body's master filters. NSAIDs can damage these filters, especially in kidneys that already have their decades. A poorly functioning kidney worsens hypertension. Additionally, they alter platelets, the cells that form clots to stop bleeding. By altering their balance, they can ironically provoke clot formation where they shouldn't be, like in brain arteries. And the third is the final blow, atherosclerosis. Chronic NSAID use fosters constant inflammation in the artery lining. This inflammation is like sandpaper scraping the interior, creating rough zones where cholesterol sticks and forms plaques. A piece of that plaque can break off and travel to the brain, causing disaster. Think about Carlos, 68 years old, a retiree who loved his garden. He suffered from knee osteoarthritis. His solution? Diclofenac. 2 pills a day, every day. It's the only thing that takes away my pain, he said. He had slightly high blood pressure but didn't give it importance. He didn't know that each pill was adding fuel to the fire. His pressure rose silently. His arteries hardened. One morning, watering his roses, he got dizzy and dropped the hose. He couldn't lift his arm. He was suffering a stroke. The culprit was a clot, but the ground had been prepared for years with each harmless pill. So, what do? Live with pain? Of course not. The key is strategy. First, and I will always repeat this, don't stop any medication on your own without talking to your doctor. That's equally or more dangerous. The solution is an honest conversation with your doctor. Ask without beating around the bush. Doctor, with my age and blood pressure, is this NSAID the safest option for me? What's the minimum dose I really need and for how long? And we must explore alternatives. Acetaminophen is usually a much safer first option for the heart. There are diclofenac or ibuprofen gels and creams that act only where it hurts, reducing systemic risk. And don't underestimate the power of physical therapy, exercise, heat, and cold. The goal is not to put a Band-Aid on pain, but to attack the root of the problem in the safest way. Second culprit, anticholinergics. Let's go to the second group. Almost no one talks about this in relation to strokes, and that's why it's so dangerous. It attacks a very common problem that's embarrassing to discuss: overactive bladder or incontinence. For millions of people, the fear of a leak limits their life. The solution is usually a pill, an anticholinergic medication. Names like oxybutinoin, tolterodin, or sulfenacin are common. They promise to restore control, and they work. But what few explain is their direct connection to your brain health. To understand this, let's talk about acetylcholine. It's your nervous system's main messenger. It's vital for muscles, including the bladder muscle, but it's also absolutely crucial for memory, learning, and cognitive function. It's the oil that lubricates the gears of thought. Anticholinergics block this messenger. In the bladder, this relaxes the muscle. Problem solved. No, not really, because these drugs aren't guided missiles, they're cluster bombs. They enter your bloodstream and travel throughout the body, reaching the brain, and there they also block acetylcholine. The first effect, the best known, is cognitive decline. Their continuous use is associated with increased risk of dementia. Patients complain of confusion, brain fog, poor memory, drowsiness. They blame age without suspecting it's the bladder pill that's turning off their brain's lights. But the danger goes beyond. The connection to stroke is sinister. Acetylcholine also helps regulate blood flow to the brain. By blocking it, these drugs can prevent brain arteries from dilating when they need more oxygen. This can create zones of low flow, preparing the ground for stroke. Additionally, effects like dizziness when standing or sedation can destabilize an already fragile cardiovascular system. It's like asking your brain's air traffic controller to work with half the staff and radios failing. Disaster is just a matter of time.
Let me tell you Martha's story. 75 years old, widowed, and very active. She started with overactive bladder. The fear of having an accident was keeping her locked at home. Her doctor prescribed oxybutinin. At first, a miracle. But over months, her daughters noticed she was more forgetful. One day, when getting up from the sofa, she felt terrible vertigo and collapsed. She had suffered a TIA, transient ischemic attack, the warning that a major stroke was coming. When doctors reviewed her medication, the connection was obvious. The drug that gave her back her social life was threatening her life. Martha's story is a wake-up call. If you take medication for incontinence, act. Don't stop suddenly. First, see if your medication is anticholinergic. If it is, call your doctor. The key question is, "Doctor, I'm concerned about this drug's effects on my brain.
Are there more modern and safer alternatives? And the good news is, yes, there are. There's a newer class, beta-3 agonists, like mirabegron, that act through a different pathway that doesn't interfere with acetylcholine and has a much better risk profile. Additionally, never forget non-pharmacological therapies. Kegel exercises for the pelvic floor work wonders. Retraining the bladder with fixed schedules is also very effective. Sometimes just reducing caffeine, alcohol, or soft drinks makes a big difference. Incontinence deserves a solution, but not one that puts your brain in check. Third culprit: systemic corticosteroids. The third group is often seen as life-saving. I'm talking about systemic corticosteroids like prednisone or dexamethasone. If you've had a severe allergic reaction, asthma crisis, or live with an autoimmune disease, you know their almost magical power. Within hours, they calm uncontrolled inflammation and give you back your life. And because they're so effective, it's hard to see them as an enemy. But this power has a price, especially with long-term use. Using oral corticosteroids chronically is like making a deal with the devil. They give you immediate relief, but the bill for your body is sky high. And one of the most serious charges is a skyrocketing stroke risk. The problem is that corticosteroids don't attack just one front. They launch a multiple offensive that weakens your defenses. I call it the triple threat of corticosteroids. First threat, hypertension. They make your body retain sodium and lose potassium. This causes fluid retention, increasing the volume of blood the heart pumps. It's the same mechanism as NSAIDs, but often much stronger. Blood pressure skyrockets. Second threat, hyperglycemia. They increase blood sugar, interfere with insulin, potentially causing steroid diabetes. Suddenly, your body becomes diabetic, and high sugar is toxic to the inside of blood vessels. It's like bathing your arteries in syrup day after day. It makes them rigid, fragile, and prone to inflammation. Third threat, lethal combination. They alter cholesterol, increasing bad LDL, and can make blood thicker, more prone to clotting. The scenario for disaster is perfect. Arteries damaged by pressure and sugar, and denser blood ready to form a plug. Think about George, 72 years old, with severe COPD. For years, he overcame each crisis with a cycle of prednisone. It saved his life, but no one thought of an exit strategy. Over time, he developed hypertension. His sugar was always at the limit. They were so focused on his lungs, they ignored the collateral damage. One afternoon reading, the words began to dance, and one side of his face went numb. He suffered a stroke. Prednisone wasn't the only cause, but it was the accelerator pressed to the floor toward catastrophe. What to do with a drug that's often indispensable? The answer isn't, don't take it. It's use it with intelligence and extreme caution. The conversation with your doctor about this should be one of the most serious you have. The goal is always the lowest possible dose for the shortest possible time. You should ask, "Doctor, I'm concerned about this drug's effects on my brain. Are there more modern and safer alternatives?" And fourth culprit, antipsychotics. And we come to the fourth and final. I saved it for last because it carries the greatest risk and is used in one of the most dangerous ways in caring for our elderly. I'm talking about antipsychotics. Drugs like risperidone, olanzapine, or quetiapine were created for serious psychiatric disorders like schizophrenia. There, they save lives. However, an alarming practice has spread: their off-label use to treat behavioral symptoms in dementia. Think of someone with advanced Alzheimer's. They may have agitation, aggression, anxiety, behaviors very distressing for them and very difficult for caregivers. In an overburdened healthcare system, the easy and quick solution is to prescribe an antipsychotic to calm the patient. But this solution is chemical Russian roulette. The world's most important regulatory agencies, like the FDA, have issued their most serious warning:
the black box warning about their use in elderly people with dementia. The reason? They almost double the risk of death, especially from stroke. The specific risk of suffering a stroke can reach triple. Their damage mechanism is devastating. First, they cause orthostatic hypotension, a brutal drop in pressure when standing. This causes dizziness and falls that in an elderly person can mean hip fracture and end of independence. But besides that, this pressure drop means that for a moment the brain doesn't receive enough blood. Repeating this over and over can trigger a stroke. Second, they can wreak havoc on heart rhythm, generating arrhythmias that form clots that travel straight to the brain. Additionally, they cause a brutal metabolic syndrome, weight gain, sugar and cholesterol increase. In months, they can induce galloping diabetes. Third, and this is more recent, they can increase blood viscosity. They make it literally thicker and stickier. Imagine Elena, 80 years old, with dementia. She was increasingly agitated. Her son, desperate, went to the doctor who prescribed a low dose of risperidone. Elena was calmer, yes, but also sleeping almost all the day. No one noticed that her pressure fluctuated dangerously. One afternoon, her son found her in the chair with a lost look and twisted mouth. She had suffered a massive stroke. The pill that was supposed to help became her executioner. This is the most difficult, but most important conversation a caregiver can have. If your loved one with dementia has been prescribed an antipsychotic, you have to be their advocate. Ask the doctor firmly, "Doctor, I know about the black box warning. Have we absolutely exhausted all non-pharmacological options? What's the plan to withdraw this drug as soon as possible?" Because the truth is, there are alternatives. The first line of treatment for agitation in dementia should never be a drug. It should be investigating why they're agitated. Often it's an unmet need. They have pain they can't express, an infection, they're scared, bored. Behavioral interventions are key. Calm environment, music they like, simplifying tasks, validating feelings. They require time and patience, much more than writing a prescription, but they're infinitely safer and more humane. Conclusion and action plan. We've taken a hard journey. I know. We opened the medicine cabinet and pointed to 4 culprits hiding in plain sight. NSAIDs like ibuprofen, those harmless painkillers that can destroy your arteries, anticholinergics for incontinence that can turn off your brain's lights, corticosteroids like prednisone that deal with the devil that calms inflammation at too high a price, and antipsychotics, that quick solution for dementia that triples the risk of the worst consequence. Today's message isn't to be afraid, it's to take control. We've delegated our health to a system that sometimes, in a rush, chooses the easy pill. But you're not a passive patient. You're the conductor of your health orchestra. The knowledge you have now is the most powerful tool. The ability to ask the right questions, to have a dialogue with your doctor, not a monologue. Don't leave with anxiety. Leave with a plan. Review your medications. Identify if any of these are on the list and schedule an appointment with your doctor. Not with fear, but with the confidence of someone who's going to take the reins. I ask you one last thing. If this video helped you, don't keep it to yourself. Share it. Send it to your brother who cares for your mother. Share it in your friend group. Every time you share it, you might be preventing an emergency call, a hospital bed, a broken life. And please, use the comments. Tell me your experience. Do you take any of these drugs? Reading your stories enriches us all and creates a vital support community. Thank you for your time and attention. Take care of your brain. It's the only one you have. Until next time.